I'm Lucy Allen and I'm a pelvic health physiotherapist, and my pronouns are she, her, and these are my top 5 tips. Tip number 1 is to take time for yourself. Give yourself time to rest. If you're experiencing pain or discomfort or fatigue, give yourself a little bit of time to just relax and recoup. Give yourself the time to tune into your body. How are things feeling? How are you doing? And don't be afraid just to allow yourself to have those 5 or 10 minutes or those moments for yourself. Tip number 2 is to keep yourself active. And by that I mean doing the activities that you enjoy. Don't be afraid to continue doing the activities and exercise things that you have always enjoyed doing throughout the pregnancy, as long as it's still feeling comfortable. Things like antenatal yoga and Pilates are a really lovely place to start. Even just getting out of the house, going for a walk and getting a little bit of you time, but keeping those activity and exercise levels up so that you maintain strength, you maintain function for what's going to be your body's biggest physical challenge yet. Tip number 3 is don't be afraid to use some aids and supports if needed. So looking at using the support bands to help give that pelvis a little bit of that extra hug, that extra squeeze to make things a bit more comfortable if that works for you. To use a pregnancy pillow or any cushion or pillow for when you're sleeping and lying down to see if that gives you more comfort and relief at night. But also to use tape, to use bands, whatever you feel you need to help provide yourself and your pelvis with a little bit more support throughout the pregnancy. Tip number 4 is to keep doing your pelvic floor exercises. Because it's a muscle we can't see, it's one that is so easily forgotten about, but it's an incredibly important muscle, not just for now, for pregnancy, but also for the rest of our lives. It's something that we really want to be trying to maintain the health of. So try and get it into your daily routine, whether that's every time you brush your teeth, or you've downloaded an app that sends you reminders, but just trying to keep it ticking over, keeping it healthy and keeping it fit and strong. And tip number 5 is to remember that PGP symptoms can continue after birth. Although for the majority, things do improve and there aren't any problems, if you are still having some symptoms of pelvic girdle pain, take it easy. In those first few weeks, first few months, look after yourself, ask for help, because it's okay to do so, and give yourself the time you need to recover and to gently get yourself back into doing exercise. If after 12 weeks you still find that symptoms are there and it's really affecting your day-to-day life, reach out for further support with a physiotherapist or healthcare professional so they can help you back onto the road to recovery.